If you are a fan of spicy food, you will always go for Mexican or Indian food. But do you know what makes these foods so spicy? The answer is red pepper. Hot red pepper is the most widely used spice in Indian and Mexican cuisine. Red pepper is highly regarded for its pungency and flavor as an additive to various dishes all over the world. It is believed that hot red pepper originated in Mexico and is now grown in tropical and subtropical regions in the United States of America, India, Japan, Turkey, and African countries. About 90% of chili peppers are produced in Asian countries. The scientific name for red pepper is Capsicum annuum and it belongs to the nightshade family. Red bell peppers are a great source of flavonoid vitamins, phenolates, proteins, and alkaloids, which plays a vital role in human health. The nutritional value of red pepper. Red pepper is a rich source of vitamins, minerals, and proteins essential for human health. It also contains essential phytochemicals such as alkaloids and flavonoids and phenols, which are important antioxidants. Properties of red pepper. Red pepper contains a large amount of beneficial healthy compounds that may be responsible for various biological activities of the body. The beneficial properties of red pepper are as follows. It has pain-relieving properties. It works as an anti-inflammatory. It has antimicrobial activity. It has antioxidant activity. It has anti-ulcer activity. It has anti-cancer activity. It has the ability to enhance memory. It has an effect on lowering blood sugar. It has an effect on lowering blood pressure. It has an effect on lowering cholesterol. It has anticoagulant activity. Helps in weight management. It has anthelmintic properties. It has wound healing activity. Possible uses of red pepper. Red pepper is used as a seasoning and condiment. It is one of the most important plants used in the management of various diseases for a long time in different countries and ancient civilizations. The health benefits of red pepper are described as follows. One possible use of red pepper is for osteoarthritis. According to a report by the UK Arthritis Research Foundation, red pepper capsaicin may be useful for overcoming osteoarthritis and fibromyalgia in humans. This is because capsaicin may have the ability to decrease B substance supply, which sends a pain signal to your brain. Hence, the transmission of pain in the body. Hence, red pepper may be useful for overcoming osteoporosis associated with pain. However, this information is not sufficient for the use of red pepper alone to treat arthritis pain. So more studies in humans are needed. Two potential uses in red pepper are anti-inflammatory. In an animal model study, it was found that red pepper may have anti-inflammatory activity, which may be beneficial in reducing swelling. Red pepper's anti-inflammatory effect may be contributed by its phenolic and flavonoid compounds. In addition, capsaicinoids and capsinoids, both of which are alkaloid compounds found in red peppers, may have anti-inflammatory activities. This stops the production of inflammatory molecules in the body. However, more studies in humans are needed to suggest the effects of red pepper in managing inflammation in the human body. 3 potential uses in red pepper for obesity. According to studies, red pepper may have a potential role in weight management. In several clinical and animal studies, it was found to reduce fat accumulation in the body and increase fat metabolism. In addition, clinical studies have noted that Eating red pepper regularly may increase body temperature and lead to an increase in oxygen demand, which leads to a reduction in body weight and fat oxidation. It also increases energy expenditure and reduces hunger, which helps in weight loss. Although studies show the benefits of red pepper for weight loss, consulting a doctor is important before using red pepper in your weight loss regimen and only using it if prescribed. For potential uses in red pepper for diabetes. Red pepper may have blood sugar lowering activity. Regular consumption of red pepper may impair blood glucose production after a meal. Red pepper may be able to disable some of the enzymes responsible for glucose production. An animal study noted that the blood glucose levels and body weight of the animal model improved. However, these studies are conducted on animals, not on humans. Therefore, large-scale human studies are needed to suggest the effectiveness of red pepper in managing diabetes in humans. Diabetes is a serious health condition that requires diagnosis and treatment. Suitable. It is done. Contact the doctor and ask for his advice. 5 other possible uses for red pepper. In the ancient Mayan and Alaskan civilizations, people used red pepper for coughing, asthma, pain, and to relieve toothache. Red pepper contains phytochemicals such as phenols, flavonoids, and vitamins. They are essential antioxidants that may help reduce degenerative disorders. Red pepper may act as an analgesic due to the active ingredient it contains. It is capsaicin, so red pepper can be used in skin patches, nasal sprays, or topical ointments to relieve pain. Red pepper may have antimicrobial properties that can effectively deal with infections caused by bacteria, fungi, and other viruses. Red pepper may be beneficial for many diseases, such as stiff joints, bronchitis, headaches, and coughing. A human study noted that patients who used a nasal spray made of red pepper as a spray reduced problems such as sneezing, congestion, and rhinitis. Red pepper may have a wound healing effect. Capsaicin may show gradual healing of skin lesions. Topical effect effectively on itching associated with psoriasis. Although studies show the benefits of red pepper in various health conditions, however, this is not sufficient and requires more studies to determine the true scope of the benefits of red pepper on human health. How to use red pepper. Red pepper is a versatile vegetable. It can be used in both fresh and dried forms. It is a widely used spice. You can use red pepper with fresh or processed vegetables or seasoning powder in dried forms to make your soup or sauce spicy as a food dye to extinguish a red-hot look on your plate. Dry red pepper is used to prepare a famous sauce called shiro powder. Do not use too much red pepper powder. Excess consumption may cause adverse effects. I advise you not to replace or quit your current medications with any herbal preparations of red pepper without consulting a doctor. He will recommend you the best form to get it. Side effects of red pepper. Although various studies show that red pepper is safe, however, some reports indicate that it may have some side effects. The side effects of red pepper are described as follows. Skin injury. Initial contact of red pepper with the skin may cause severe skin irritation, burning pain, tingling, skin redness, swelling, blisters, itch. Eye injury. Initial contact with the eyes may trigger an involuntary reflex closure of the eyelids, red eye swelling, constant pain, tearing down, photophobia, nose injury. Inhalation of red pepper powder may cause immediate inflammation of the mucous membrane of the respiratory tract. throat irritation, burning sensation, coughing or choking, shortness of breath, continuous sneezing, not being able to speak, stomach injury. Excessive consumption of red pepper for a longer period may cause stomach discomfort, spasm, pain, loose movements, chronic gastritis, kidney or liver damage, severe injury. Red pepper may contain aflatoxin, a carcinogen. Aflatoxin contamination may be due to poor cultivation, harvesting, and post-harvest practices, which may cause undesirable effects on health, skin cancer, high blood headache, increased risk of strokes and heart attacks. However, if you see any of these side effects, immediately rush to the hospital, contact the concerned doctors, and get the appropriate treatment. Precautions to be taken with red pepper. Consuming red pepper in small quantities is safe and with need. General precautions should be taken due to side effects and drug interactions. People who take blood pressure medications should avoid red pepper because its ingredients may interact with these medications. This leads to a loss of drug efficacy. There is no major report indicating the safe use of red pepper for pregnant or breastfeeding women. Therefore, you should consult a doctor before taking it as an herb because it contains certain toxins that may affect your health. People should be extra careful while giving paprika to young children and the elderly, because red pepper has side effects that may cause stomach discomfort in children and the elderly. People should not use red pepper for self-medication. Consulting a doctor is important to avoid further complications. Red pepper may cause life-threatening toxicity. Therefore, it is imperative that you understand the risks associated with this herb and make yourself aware of this uncommon symptom of red pepper affecting your health. Interaction with other medicines. Red pepper may interact with some medicines, which leads to the interaction of herbs with medicines. Management may be common. Red pepper, aspirin, and salicylic compounds are harmful. Red pepper may also reduce the activity of beta-adrenergic blockers, which are blood pressure medications such as methyldopa and calendil. So if you are taking high blood pressure medication, avoid eating too much red pepper. If you notice any complications, immediately rush to the hospital. In addition to, I recommend that you disclose your ongoing treatments to your doctors and follow the precautions and dosage prescribed to you.